If you need to distinguish between the left and the right bone, proceed as follows. First, identify the head of the humerus proximally and the condyle distally. The latter is involved in the elbow joint. Next, study the articular surfaces. Observe that the head of the humerus, which also forms the head of the shoulder joint, obviously faces medially, whereas distally, the prominent medial epicondyle is identifiable. To distinguish between the anterior and posterior surfaces, have a close look at the distal epiphysis. Anteriorly, there are two round depressions superior to the condyle. The coronoid fossa is on the ulnar side, and the radial fossa is on the radial side. Posteriorly, there is a single depression, the olecranon fossa. By taking into account all the above information, you can now tell whether you are holding the left or the right bone. This, for example, is the right humerus. There are a number of features on the surface of the humerus. These include the following. This is the anatomical neck. These are the greater and lesser tubercles, which distally continue as the crests for the greater and lesser tubercles, respectively. Between the tubercles, that's the intertubercular or bicipital groove. Next, this is the surgical neck. That's the deltoid tuberosity. That's the groove for the radial nerve. Distally, these are the medial and lateral epicondyles, and their proximal continuations, the medial and the lateral supraepicondylar ridges. Finally, that's the groove for the ulnar nerve. The condyle of the humerus is formed of two parts. Medially, that's the trochlea, which articulates with the ulna, and laterally, that's the capitulum, which articulates with the radius. The diaphysis is called the shaft or body